So when we are considering the conditions for treatments that are provided here at the Maharaj Institute, we have to think in terms of, first of all, looking at the immune system and what diseases occur as a result of immune dysfunction. The disease that most people think about is cancer. And so, of course, cancer is one of the most common diseases that we treat at the Institute. And there are two types of cancers. There are the blood cancers, and then the cancers caused that are classically called solid tumors. An example of that is breast cancer, colon cancer, prostate cancer. Patients tend to fall into that category where, and I can think of one disease that comes to mind as a patient who we're currently treating. This is a patient who was diagnosed with a chronic lymphocytic leukemia. Now, chronic lymphocytic leukemia, traditionally, which accounts actually for the largest number of cases of leukemia. 25% of all cases of leukemia are actually chronic lymphocytic leukemia. This patient was diagnosed a few years ago, and she was initially seen by her oncologist and hematologist, who, after doing the blood counts, basically said, well, we'll do what's called a watch and wait. However, the patient was very anxious that instead of watching and waiting, because what she saw happening was that her white cell count was going up. And every time she would go back to see her doctor, which was every 3 months, the white cell count is going up. And then she started getting symptoms. So at that point, the doctor recommended that she gets treatment, which would be chemotherapy. But when the patient saw the side effects associated with the chemotherapy, she said, I really don't like this. I'm going to look to see if I have any other options. That's when she contacted us. And when she contacted us, the approach that we took was basically looking at the disease, but looking at the disease in a different way, at a deeper level. We looked to see if the patient had what percentage of the cells, of the cancer cells, which are called lymphocytes, what percentage was in the blood. And we found that 95% of all the B cells in the blood were cancer. Second thing is that we found that the patient actually had a cancer gene which predicted for, in fact, that she would have a worse prognosis, and that's actually why the blood cell count was going up. And the third thing that we did was we measured her immune system. And as is typical in these patients who have chronic lymphocytic leukemia or cancer, the components of her immune system, the B cells, the T cells, and particularly the natural killer cells, were very abnormal. And that explained why the patient's blood counts were rising so quickly. So we designed a personalized precision approach for this particular patient to target the abnormal cells, and then secondly to correct the immune system. And what we found was that in this patient, within the first 2 weeks of the treatment, that her white cell count, which was running at 114,000 when she first came to see us, dropped down. Within 2 weeks, it dropped down to actually to less than 20,000. And within the next 2 weeks, the blood counts had normalized. And the numbers of the abnormal lymphocytes was basically now within the normal range. We have to repeat the testing, of course, to be able to show what the exact numbers of the cancer cells are. So that's an example of a patient who was told early diagnosis, let's watch and wait. But in fact, by looking at the cancer at a molecular level, we were able to see why the disease was actually progressing at this early stage.